Being part of the Teaching Kitchen Collaborative has shaped how I do my work. It's not just a professional group, it's a real community.
Being a member of TKC means I am a part of something big, something significant.
Teaching kitchens are the future of health. It all starts in the kitchen. So, how did we get here? In 2007, the conference known as Healthy Kitchens, Healthy Lives, hosted by the Harvard T.H. Chan School of Public Health and the Culinary Institute of America, gathered doctors, nutrition scientists, and chefs to answer a shared question: can the kitchen be the front line of public health?
But that was essentially what the teaching kitchen is. Their teaching was that doctors needed to be role models of how to eat, cook, move, think more healthfully. Every year at Healthy Kitchens, I said, someday we should build these kitchens in hospitals. And in 2014, I asked the audience of 500 people, have any of you built or thought about building a teaching kitchen in a hospital? And 100 hands went up.
What emerged was more than dialogue. It was a mandate. In 2016, that mandate became the Teaching Kitchen Collaborative. We started really small with a handful of institutions who were willing to imagine together how teaching kitchens could be a pathway to health, connection, and behavior change.
The Bakken Center was invited to be a part of this founding group that became the Teaching Kitchen Collaborative. And Kate, you referred to it as a professional home. And I think that's such a beautiful way of describing it. It is a place we can keep going back to and keep finding colleagues and partners and resources.
And I think it was so fundamental to our starting out because it was in a time 10 years ago when we were really forging a new path and we didn't have a lot of examples of that out there. And so by connecting with the TKC, we were able to find colleagues that were trying to do similar things and share, stories and tips and challenges and struggles and also ways to overcome them.
In 2015, the Collaborative hosted our first ever members meeting. And since then, we've convened our members every year, held public symposia and research conferences, developed toolkits and curricula, and strengthened our community with professional development opportunities. We champion data collection, so teaching kitchens aren't just nice to have, but are measurably effective.
It means collaboration. It's right there in the name. I have met and worked with so many amazing people around the country and around the world as a result of being in the TKC.
Unfortunately, science and medicine are competitive and territorial. And the teaching kitchen community is the opposite. It's inclusive, and it says, as Chef Jose Andres often shares, build a bigger table instead of saying there's not enough room.
The collaboration is genuine, and everyone understands that working together is the most impactful way to achieve better global health. I've gained motivation, tools, and framework from the organizers and members to advance a healthcare-based teaching kitchen in a much-needed area.
There's lots of different types of teaching kitchens: academic, community-based, health system-based, university-based, and everyone does things just a little bit differently.
We can make a teaching kitchen anywhere. In a library, in a school patio, a homeless shelter. We've done it at the beach.
As we grew and gathered more members from academic and healthcare settings, corporate America, and community-based organizations, we found our role: connecting teaching kitchens to each other, to evidence-based resources, and to the research that validates this work.
We just did our first Teaching Kitchen multi-site trial, which we were one of the sites for. So really building that evidence base even more to show everyone that this is an effective and a really wonderful way to help people reach their health goals.
There is an increasing awareness of food as medicine, culinary medicine, lifestyle medicine, and a greater need for all of us to become healthier.
An interdisciplinary synergy between chefs, dietitians, and physicians is more important now than ever, and the Teaching Kitchen Collaborative gives us space to connect and grow and learn together.
Being part of the TKC means standing alongside leaders who are redefining health, healthcare, and the nutrition conversation, really bringing it back to the kitchen as a place for meaningful change.
Over the last 10 years, we have been there as teaching kitchens have taken root nationwide, inside hospitals and community centers, in medical schools and universities, and in corporate cafeterias. Everywhere with the same discovery: people learning what to cook, why it's important, and how to make it unapologetically delicious. Today, more than ever, these teaching kitchens aren't working in isolation. Collaboration has become our currency between institutions, sectors, and people. We're learning from each other, sharing what works, and building this movement together.
As an art educator by trade, I was surprised at how quickly and deeply I embraced this new passion for using food as a powerful way to connect science, history, play, and culture, a platform for helping us better understand ourselves and one another.
I didn't expect the Teaching Kitchen Collaborative to add even more fire to our team's motivation to develop our programming. Specifically, TKC's offerings in evaluation and curriculum writing has really helped us ask more questions, look for opportunities for improvement, and just generally build richer programming for the communities that we serve.
This work sometimes can be hard. It can be heavy.
You might feel like the only voice in the area where you are currently planted. But don't worry, there are plenty of other weirdos out there who think just like you, and they want to do something better for themselves.
Meeting with others who are going through similar challenges, similar barriers, and learning how they overcome and the creativity that they use, it feels validating, it feels supportive.
I didn't expect to feel so supported here. We're building something together. That matters.
Expect is really lifelong friendships. So many of you I've really gotten to know so well over the last 5, 6, 7, 8 years. I really consider to be lifelong friends. And so I'm so thankful for the relationships that I've developed over the years.
The Teaching Kitchen Collaborative has offered a space for belonging and true vulnerability, which has led to connections, deep relationships, and friendships. It's in this space that the spirit of the Teaching Kitchen Collaborative community thrives. It's this spirit of connection and community that will move us forward together in the future.
We are building on 10 years of foundation with this network, the evidence base, and the momentum to scale the movement in ways that could only be imagined in 2016. As we enter our second decade, we have proven that teaching kitchens work. But we've also learned that impact alone doesn't guarantee sustainability. And that's what has to change. Our next 10 years won't simply focus on growth. We'll focus on permanence. We will ensure that teaching kitchens are so clearly valuable, so rigorously documented, and so deeply woven into healthcare and education that their place becomes unquestioned. Our membership is growing and their needs are evolving. Our collaborative is really committed to being responsive and nimble in order to meet those emerging needs of all of our members. We're working to position our members so they're ready for a whole new decade of opportunities, armed with the data, inspired by the collective impact, and fortified with the strength of this community behind them. In the next 10 years, we'll advocate boldly for the health of people and the planet through food. We'll advocate for policies that recognize teaching kitchens as essential health infrastructure, because when people learn to cook, they don't just change what's on their plate, but their entire relationship to food, their health outcomes, and their communities. We're going to help our members innovate. Virtual kitchens, mobile units, cross-industry alliances, co-design models. The teaching kitchen of tomorrow must be as flexible as possible to adapt to the communities they serve.
If I could describe the TKC in one word, it would be transformative.
The TKC means hope.
Teamwork, community, innovative,
empowering,
connected,
optimism,
Delicious. Fun.
inspiring,
encouraging.
When I think of the TKC, what's one word I think of?
connection! Happy birthday, TKC!
Here's to the next 10 years. To the thousands who will walk into a teaching kitchen expecting to learn and leave empowered and inspired. to our partners who see food not as cost, but as investment, and to the communities for whom these kitchens are not extras, they're essentials. The Teaching Kitchen Collaborative will be the best support system for teaching kitchens around the globe. Our work continues, and this invitation is open. Welcome to what's next for the Teaching Kitchen Collaborative. Welcome to the next 10 years.